what is sexual health and how do we optimize it?
So sexual health is often something that we just like brush under the rug, right? But in reality, sexual health is health. And I'd like to say that because it's a marker, it's a biomarker of our overall health. So when you think of a good sexual functioning being, a human being that has good sexual function, we know that they're getting signals from their brain down to their genitals well, so their nervous function's working well. We know they're getting blood flow to their genitals well. We know that they are generally not super stressed or super unhappy because they're able to focus on sexual wellness and be happy and enjoy it, and their body responds appropriately. So we know we can learn a lot about a person through their sexual health. And conversely, when somebody has a problem with their sexual health, it can be devastating. And it can take over their entire life and the way they think and what they're thinking about and perseverating on. And no one talks about it. So they have no one to talk to. And they're struggling internally with these issues that they really can't bring out to light.
Wow. I know for men in particular, erectile dysfunction can be an early indicator of deeper chronic health issues.
Yeah.
Is there, what can you speak to that? And is there an analog in women?
Yeah, so when you think about analogs, we'll say the penis is the analog of the clitoris. And that's because they're actually formed embryologically from the exact same structure called the genital tubercle. So when you're a fetus, it's a genital tubercle. If you get the genes to become a boy, you're going to have develop a penis, and if you get genes to become a female, you're going to develop a clitoris. So they're exactly identical. If you look at them under an anatomical sections, they're identical. Two erectile bodies, same blood flow, patterns, everything is identical. And so when you think about with men, we know that when men develop erectile dysfunction, if it's of a vascular cause, but all comers, you don't know if they're vascular or not, all comers, with all the men who develop erectile dysfunction, within 7 years after developing ED, 15% of them will have a heart attack. Wow. So it is because it's a marker of decreased blood flow. Because the blood vessels to the penis are 1 to 2 millimeters in size, whereas the blood vessels to the heart are 3 to 4 millimeters in size. So when you have any sort of blockage due to high cholesterol, plaque buildup, blood pressure issues, you're going to see it first in your penis before you see it in your heart. Now, for females, it's not as obvious because we're not seeing clitoral tumescence readily like we are in men, but women have clitorises that tumesce when they're aroused throughout the night, just like men. They wake up with clitoral tumescence. They may not realize it. They may feel a little pressure. It may go away. And so getting normal arousal is often a sign that things are working well. Now, it's harder to say because it's very complex in terms of desire and arousal are confusing for women a lot of the times. They may lose desire, but that's distinct from arousal. Arousal is that your body has a response, a physiologic response to something that's deemed erotic or arousing. And so that is more of a physiologic indicator, whereas desire is more biopsychosocial. So there is a biological component, but there's also a psychological component. There's also social components. So there's a lot of factors that go into desire.
It's very interesting. I've heard that medical textbooks, it's only recently that they were updated to include an accurate representation of the anatomy of the clitoris. That the clitoris is not just this eraser-sized nub, on the external genitalia, on the vulva, that there's actually like these legs that go around. Can you speak to that a little bit?
Yeah, so there's a shaft, just like the penis has a shaft, there's a shaft that goes deep into the pelvis and then it bifurcates. And in men, it bifurcates as well. So there's a bifurcation, there's two legs, and in women, it goes around the vulva, around the vaginal canal. And in men, it goes down into the perineum. And so we do have these same two legs, and they also bifurcate in men a little bit. And so interestingly, it's exactly the same anatomy. It's just a little bit shorter in females, and it's not protruding externally like it does for men. And with women, it doesn't have a urethra in it, right? There's no pee coming out of the clitoris. So it's actually the only distinct organ in the entire human civilization that's for pleasure alone. There's no other function of the clitoris than to just have pleasure.
Fascinating. So would you say that libido, in a way, is a good, relatively decent proxy indicator for health? I've always thought that if you're horny, if you're hungry, and if you're happy, like it's a fairly, maybe not like a perfect representation of one's health?
Well, it's a good sign if you're having a normal amount of arousal, desire for sex. And what's normal is very relative. So I don't want people to think if you're really horny, that's a bad thing. That's fine. But because desire, like I said earlier, is so complex, right? If you're stressed at work, if you're have a lot of competing things in your life, it can be really hard to feel desire. And the interesting thing about desire, so men and desire for sex, specifically vaginal penetrative sex, which is not the only kind of sex, right? But for that type of sex, typically men look at it as a stress relief, right? Like having sex is going to relieve stress. It's something I enjoy. Whereas oftentimes women look at it more of as a chore. And so it doesn't actually lend itself to that stress reduction. And some of that is a social construct, like we've got all this other stuff to do. And, this is a waste of time. It's not necessary, whatever, right? And some of it is, that's just how women's brains works. They tend to take on all these other responsibilities of motherhood, of maybe taking care of their aging parents in midlife, particularly when you've been in a relationship for a long time and that novelty sort of starts to decline. And so all those things together can contribute to low desire. And it's not necessarily that they're not physiologically healthy.
That makes a lot of sense. Well, I want to talk about men and women's distinct needs, but let's start with women, I guess, and vaginal health. Mm-hmm. What do women need to know about vaginal health? I mean, I feel like it's a big topic. It's probably taboo in certain circles, but there is nothing that's off limits to this podcast at least.
Yeah, no. So I like to say vulvar health, right? So I think when you're young and healthy through perimenopause, you are getting good blood flow to the area as long as you are healthy. Like you're maintaining your weight, don't have high blood pressure, you don't have diabetes, you don't have high cholesterol. All those things will affect blood flow to the clitoris and may cause, issues with arousal and things of that nature. But generally speaking, there's not a whole lot you have to do during those years. You just don't want to overdo anything. So we've been told as women in society that we need to wash, we need to smell a certain way, menstruation is bad, like all these things, right? None of that is necessary. The vaginal canal is like a self-cleaning oven. It has a very distinct microbiome. And when you start douching or washing too much, you can actually disrupt that microbiome. So that's one. Two is, so then you're probably like, well, I need to wash down there. Yeah, you should wash the hair-bearing areas with like a sensitive soap, like a Dove sensitive soap bar or whatever generic brand, doesn't matter, and wash the hair-bearing areas because that's where sweat comes in, and then there is an odor from that. But other than that, if there is an odor from the discharge or something that's new, then talk to your gynecologist or your primary care doctor about it to make sure there's nothing else going on. But there is supposed to be an odor. People are not odorless. And so I think people get very fixated on that, and very often it's just your natural smell. That's how you smell, and that's not a bad thing. We don't need to smell like key lime pie or whatever, peaches or anything like that.
Well, are there other reasons to avoid fragranced personal care products? I mean, fragrances in terms of the packaging and the labeling usually can represent hundreds potentially of compounds that have endocrine disrupting abilities like phthalates and the like.
Yeah, so I mean, it's hard to take the fragrance because it's such a small amount usually and extrapolate to phthalate exposure. Yes, over years and years and years, it's additive, but I would say more so is that it's irritating. A lot of times the components in fragrance can cause like dermatologic changes. And then you actually can start having symptoms of like, oh, it's really itchy or, or whatever. And it's actually, there's nothing wrong. You don't have a UTI. You don't have bacterial vaginosis. It's just that you've been using all these products all the time, or you're washing so excessively that now you're manifesting these symptoms because you've over dried out or irritated the tissue
over sterilized the tissue,
or just irritated it from the fragrance and from the things like that. So generally I would say again, gentle soap is the way to go.
How concerned are you about recent reports that have shown that tampons harbor heavy metals, not just heavy metals in fact, but PFAS compounds, endocrine disrupting compounds? And then also recently I saw headlines where there's a lawsuit being waged against certain condom manufacturers, like condoms.
I just saw that. I didn't read too much into it yet. In terms of both of those, I don't know enough about the specifics of those cases. But I will say that we always have to take a step back and realize like the toxin, the dose makes the toxin, right? So if there's microscopic amounts of something in anything we find, we have to take a step back because we're exposed to this stuff all the time just by living where we're living, right? There's radon coming from the ground. Like we're going to be exposed to a whole bunch of things every single day. And so it's more about deciding like, is this dose that we're finding in these things actually toxic to us? And, what is the true level of toxicity where it becomes a problem?
What about avoiding UTIs? This is a big question. Can UTIs potentially be stress-induced? There is, I polled my audience and we had some really interesting and fun questions, but important questions. Does sleeping with, if you get a UTI, does that indicate that he's not the right man for you or that he's dirty?
Mm-hmm. No, this is a great question. And so back to you said about vulvar health, I stopped at perimenopause. So when you go through menopause, you start having changes in your vulvar tissues, or if you have any sort of low estrogen state, that could be after having babies, tend to be a low estrogen state. If you have certain disorders that decrease estrogen, that will change the microbiome, that will change the pH of the vaginal canal. And so normally it's acidic. So when the pH goes up, becomes more basic during this time of low estrogen, that makes it more likely that the bacteria can grow in the vaginal canal and then get into the urethra and create recurrent UTIs. So it's really important to know that, and that then using something like vaginal estrogen, if there's no contraindications, and really the only contraindication is active breast cancer, otherwise it's very, very safe, using something like that will help prevent UTIs significantly. In fact, it's one of the most well-studied treatments for recurrent urinary tract infections in women with low estrogen states. So
and this is for women in the peri and postmenopausal.
Yeah, and if they have any other low estrogen state, like they're lactating or some other issue of that nature. And so in those cases, vaginal estrogen can be very helpful. It can also help the vulvar tissues, and we don't talk about that enough, but they're all very estrogen sensitive. So when women go through menopause, they're going to actually, their labia minora will shrink. Their clitoral hood may shrink back a little bit. Their clitoris itself may shrink a little bit. And this is all due to hormonal changes. So generally speaking, it's important. I tell all women to look at their vulva. When they come see me as a patient, we take a mirror, we look, we go through all the anatomy. Because if you don't look at it, you don't know when things change. And when you may say, okay, like I'm noticing a difference. I'm noticing maybe there's this bump here. Maybe there's something going on. Maybe I need to investigate further. So that's one thing I think for recurrent urinary tract infections, very commonly in the perimenopausal and menopausal space, it's very often because of this change. Now, in younger people, the number one thing, hydration can be very, very effective in preventing UTIs. So in fact, in studies, when you drink 1.5 liters more of fluid, your UTI rate will decrease by 46%. So if you're having UTIs, and what we describe as a recurrent UTI is having more than 2 in 6 months or more than 3 in a year. And that's like a red flag. You shouldn't be having that many. And if men have a UTI, you shouldn't have any, period. So that's a red flag, just having one. And so that's a simple, easy thing you can do. Now, with sex, you can absolutely get post-coital UTIs, or after sex, basically getting UTIs. It's not because your partner is dirty. It's not because they have some infection. It's because of the thrusting motion of sex, right? And that thrusting motion can then displace some of that bacteria that makes it more likely for you to get a UTI. And then you may have some anatomic predisposition, meaning like you might have a little bit of a shorter urethra, or there may be something else that is causing it. Like maybe you're constipated, that makes you a little bit more, puts you at higher risk of UTIs. If you're using a spermicide, that puts you at a higher risk of UTIs. So there's certain things that we sort of want to figure out and isolate in terms of like what is the issue, and then we can treat it based on that. And lastly, you mentioned stress. So stress is interesting because stress can cause pelvic floor dysfunction. So just like people get TMJ and they clench their jaw when they're stressed at night, they can also clench their pelvic floor. And when your pelvic floor is clenched, it can't do its normal range of motion functions. Maybe it makes it more difficult to empty your bladder because it's not relaxing enough when you urinate. And that can create a setup for UTI. So if you're ever feeling like, people are rushing out of the bathroom, they're maybe hovering all the time over the toilet seat because they're worried that, they don't want to get an infection. But like if they don't relax and sit and relax their pelvic floor, they're not going to empty their bladder fully. And then that urine that remains there is like food for bacteria. And so if you find that you're always getting UTIs when you're stressed, talk to your doctor about a pelvic floor exam or see a pelvic floor physical therapist who can evaluate your pelvic floor and teach you some relaxing exercises to learn how to then kind of relax the muscles and then use them functionally normally again.
Wow. So counterproductively, being a germaphobe with regard to public toilets can actually increase your risk for
yeah,
UTIs.
if you're doing it every day, like on and on and on, yes, absolutely. Or we see that like people who work in like nursing or hairdressers or people who never get time to go to the bathroom, right? They're always teachers. They're always holding their urine for like hours and hours and hours. And it's okay once in a while, right? You're in a long car ride, you can't make it to the bathroom. That's okay. But like if you're doing it continuously, that can actually change the function of your bladder. Maybe makes it squeeze a little less well, or your pelvic floor gets more tight so you're not emptying well. And so these things can be counterproductive if you're doing them over and over again. Now, once in a while, again, not a big deal. Like if it's a really dirty toilet, it's okay, hover, right? But like just don't do it all the time.
Why is it the case that in older adults, UTIs can sometimes cause brain fog and even symptoms that look akin to like a dementia?
Yeah, I think it's a matter of just the way bacteria affect elderly people in general. So they can have any infection and they will have cognitive effects more readily than younger people. And it's probably because the blood-brain barrier becomes a little weaker as you age. And so you absolutely can see changes that are more akin to dementia changes, which can be really dangerous and really scary for the person taking care of maybe the elderly person. So like if, say it's, I have couples who come in and they're really worried about their partner who's always just like getting so crazy, and then they can't even, they're huge, big people. So you can't, like a little kid, you can't like really restrain them, or, we don't want them to fall. There's a lot of issues there. So it's really important if you have someone in your life who's suffering from recurrent UTIs to really get evaluated and figure out like what are the things that we can do to prevent them. And there are a whole host of things. And I've talked about a couple, right? Hydration, avoiding constipation, if you are postmenopausal, vaginal estrogen, or in a low estrogen state. And then, there's also other things that are sort of have some evidence, not super strong, but cranberry. In fact, there was a very recent study that showed cranberry juice, concentrated 100% cranberry juice, was actually very effective in reducing recurrent UTIs. So drinking like 8 ounces a day.
Is that because it changes the pH of urine, or?
It's because it has an active ingredient called proanthocyanidins, and that actually takes the bacteria and it coats it so that you, instead of it sticking to the bladder wall, you'll pee it out. And so you need to have a high enough dose. So if you take a supplement, it has to have 36 milligrams of proanthocyanidins, and it has to be soluble. So if you can't palate the drink, right, it's very hard to drink 100% cranberry juice. You can get a supplement, but you have to make sure it's the soluble form, 36 milligrams of PACs. A lot of times they'll say, it's the whole berry, but they're using like the skins and the stems of the berry, which don't have any real active ingredient in them. So you want to make sure it's the soluble, like the fruit of the berry, that they're compounding into a supplement for you.
Wow. Yeah. Why is peeing after sex important to prevent UTI, and how soon after sex should a woman pee?
So there's no strong evidence actually to support that peeing after sex makes a difference.
Wow. I feel like that's like common knowledge, but you're saying it's...
there's no evidence, but I will say that I tell patients, like, if you're doing it and it's not like causing you a lot of distress to get up and pee afterwards, that's fine, right? Like, go pee. Like, there's no harm in it. If you feel like you have to. If you're not having UTIs and you're feeling fine, there's really no absolute necessary need to, based on data. Now, some people will say, no, if I don't, I'm going to get a UTI. I know it, then pee. By all means, like science, just because it's not in the literature doesn't mean that it's not affecting you as an individual. But I would say some people get they're like, I got to go shower after every time I have sex. And I'm like, no, you don't have to do that. Yes, you can pee. That's totally fine. But like doing more washing isn't going to prevent UTIs. In fact, the people who have recurrent UTIs are like the cleanest patients I know. They're so obsessed with their hygiene. And that's not the reason they're getting UTIs, right? There's some abnormality in the way their body fights infection that we don't know yet, right? We can't pinpoint exactly what that is, but it's not from hygiene. I've never met a patient where it's been from hygiene, like ever in my life.
That's so interesting.
Yeah.
Wow. Is sleeping on your stomach bad for the bladder? Can that promote UTIs?
No, not really. I mean, unless you have a baseline dysfunction already, right? Like then perhaps, I guess, but no, not really.
It's all so fascinating. Let's talk a little bit about the pelvic floor health, the health of the pelvic floor. This is a big topic. How do we strengthen our pelvic floors? Correct me if I'm wrong, but I heard you on a podcast talking about how orgasms actually help to strengthen the pelvic floor.
They do, because what happens during an orgasm? Your pelvic floor builds in tension, it contracts very strongly and then relaxes. So you're basically creating a strong contraction of the pelvic floor during an orgasm. And so if you have orgasms, you're exercising your pelvic floor. Now, does that mean you have to have orgasms to strengthen them? No, but certainly nice if you are having them, good. It's a great thing.
Is this true for both men and women?
Yeah. Absolutely. So same thing happens for both men. And men, I don't think spend as much time thinking about their pelvic floors, but men also have a pelvic floor, and they can also develop pelvic floor dysfunction, and they can also benefit from strengthening their pelvic floor. So when you think about the pelvic floor, it's like this bowl of muscles, sits in the pelvis, connects to a whole bunch of structures, your spinal cord, your hips, and it's basically holding up all these organs. So for women, the uterus, for men and women, the bladder, the rectum, it's holding all these up. So it's got holes in them, essentially, where these structures go through them. And so when there is good normal function, it's stable, it holds things in place, it relaxes when it needs to, it contracts when you're doing an effort to help you keep things strong. And so you're able to walk normally, you're able to have good stability, you're not having pain, you're not having dysfunction, you're having good bowel movements, you're having easy urination, no problems with urination, you're having strong, excellent orgasms, you're having good erections for men, you're having normal tumescence for women, and there's no pain associated with them, right? So that's sort of a sign of a good, healthy pelvic floor. Now, if you want to strengthen that and you have a healthy pelvic floor, that's totally fine. And that you can do with Kegel exercises, which is, it's one exercise. There's lots of exercises you can do, but it's sort of the most popular one. And what it is essentially doing something to do a contraction and a relaxation of the pelvic floor. So the way we describe it is often when you're peeing, if you were to stop the flow of urine during that stream, that's a contraction or Kegel exercise. Now, we don't want you to do it every time when you urinate, because you could develop a dysfunction then. So you learn how to do it, and then you can do it. So for women, we'll say you want to feel like you're squeezing up and in. You're trying to pull maybe a marble up into your vagina, something like that. You're maybe holding in a fart. For guys, it can be like you're trying to lift your penis without actually touching it. And so those are sort of cues that we can use to help people learn how to strengthen their pelvic floor. And so you hold for 5 seconds, relax for 5 seconds. And you may not be able to hold it for 5 seconds at the beginning. It may just be 1 second. And that's okay. You're just, again, working your way up. It's not like, let's just do 100 of them. Let's actually develop the strength. So you do them lying down first. So you're not using any other accessory muscles. You're just focused on the pelvic floor, and you're squeezing and you're relaxing. And the relaxing part is super important, because if you're always squeezing. So I have sometimes when you use these like devices that you put in the vagina, like you're always squeezing, like there's never a relaxation time. So, you need to have that relaxation time, or you will get dysfunction, right? So just like if you went to the gym and you just held the weight for hours and hours, like not a great idea, right? So I think, work your way up. And then once you're good at that, you do it sitting, and then you can do it standing, and then you can do it anywhere. So I say start with 10 in the morning, 10 at night, just like you would do with any workout, right? You would start with one rep, one set, like you're going to work your way up, right? And so you can do that if you have good normal function. Now, if you have any issues in the areas I spoke about, you want to get evaluated first, because if you have some tension in your pelvic floor, and you go to strengthen it, you may actually cause dysfunction, right? You may actually start seeing symptoms that are problematic. Like you might have pain when you have an orgasm. You might have pain when you have sex. And this may all be new, right? And it very often can manifest with high stress times. It can very often manifest after having babies. It can manifest. So there's a whole bunch of people like, oh yeah, I used to have that. Now it's gone, because they were in a very stressful time of their life, and then they got through that, and their body worked it out. But sometimes people need help. They need to work with a pelvic floor physical therapist to learn how to downtrain those muscles.
And what are some signs of a weak pelvic floor muscles?
So weak in women, it's very often leakage. So they'll notice that they're leaking when they're coughing, sneezing, lifting heavy things. That's called stress incontinence. So that's a very common sign of a weak pelvic floor. Also, pelvic organ prolapse. So when they start feeling like a bulge in the vagina, that can mean that maybe there's pressure on the anterior vaginal wall. It's sort of weakening. So they might actually see a bulge or feel a bulge or feel like something is coming down. And that can be on the bladder side, on the rectum side, on the uterus side. And so that can happen, and that can be a sign of a weak pelvic floor.
Wow. So interesting. Yeah, I mean, you've covered some really interesting ways to help strengthen the pelvic floor. I find tell me, when I'm doing in the gym, the hip adduction machine, I feel like when I'm, because I'm not all that cognizant of my pelvic floor muscles, maybe this is common for men.
Yeah.
But I feel like that's it's really effective in terms of helping the mind muscle connection. For me and my pelvic floor muscles.
Yeah, absolutely. So the hips are very interconnected. So sometimes people will start developing pelvic floor dysfunction because they have like a labral tear in their hip, or there's some dysfunction with maybe one limb is shorter than the other, and they start, they have an injury in that area, and they all of a sudden if you think, again, it's all connected, right? So if you're off kilter, if you're off alignment, then your pelvic floor muscles are no longer like in alignment like this, they're sort of angled, right? And so then they are trying to compensate for that, and then they become dysfunctional. So absolutely strengthening your hips is a great way to, you want to strengthen all the muscles around your pelvic floor. So your hips, your lower back, you want to focus on all those muscles. Those are your biggest muscles, right? And they're really important for just maintaining strength of the entire body, keeping yourself aligned, when you fall so you don't get injured, right?
Yeah. When it comes to bladder control, do you have any tips, tricks, so as not to need to pee in the middle of the night? This is a bit, I mean, I wake up every single night to pee.
You do?
Yeah.
You're too young for that.
Am I?
I think so. So generally speaking, people above 55 or so will wake up once a night to pee, and that's considered normal. The reason for that is because after that age, our brain the way our body releases certain signals to the brain, we release more of this thing called ANP or atrial natriuretic peptide, which then causes you to produce more urine at night. So about a third of your urine output starts happening at night as you age. But when you're younger, you should be able to have a bladder capacity that allows you to sleep through the night for most people. Very often, the most common thing is that you're just drinking a lot before bed and you're not like really slowing down that fluid intake. And when you're younger, you can get away with it, right? You can drink a ton. You might remember when you were younger, you would drink, you'd go out partying, and you would sleep all night like the dead, and you'd wake up and you'd pee, right? It wouldn't matter. But as you age, you got to sort of be mindful of how much you're drinking before bed. So that's the first thing we tell people is just drink a little less in the last 2 hours before bed. If you got to take supplements or pills or whatever, take it with a sip of water. Don't take a huge glass of water. And that will cure a lot of people. Now, in terms of other reasons that people wake up, there's a lot of different reasons. So things that you can control, again, constipation can affect your bladder a lot. So if you are constipated, just think about the anatomy. The rectum is right behind the bladder. So when it gets full of stool, it's now pushing against the bladder, which makes your bladder more active. So it's like, oh, there's something there pushing, so I better pee. And so it's going to wake you up with that urge to urinate. So one is treating your constipation. Two is thinking about what you're putting in your body. Some people are sensitive to certain things like bladder irritants. And so there's a whole host of them. The big two are caffeine and alcohol. So if you drink a lot of caffeine, and some people are not bothered by this, and I will say any of these irritants I'm going to tell you, everyone's a little different. So don't stop everything, but I say, experiment. Take a couple things out of your evening routine and see if you don't wake up, right? So it can be coffee, tea, chocolate, right? Those all have caffeine in them, any form of alcohol. For some people, citrusy fruits and juices can cause irritation, tomato-based products, artificial sweeteners, and even carbonated beverages for some people. So, just sort of like deciding and seeing what you can eliminate to see if that makes it better for you overnight in terms of, not waking up to pee. And then other things that are, generally an issue is, of course, I think a good way to measure how much you're drinking is just look at your pee. If it's clear, you're probably drinking too much. And if it's like dark yellow, you're not drinking enough, right? So I tell patients to aim for like a lemonade yellow, and that's a good color. And you'll know that you're, not drinking too much. There's usually not a problem with drinking too much, but you can get electrolyte abnormalities and you then need to supplement. And so, just sort of aim for a good amount of fluid, but not too much. And if you drink too little, in fact, that can be a bladder irritant. So if you're dehydrated or you're drinking and your urine's really dark, that dark concentrated urine can irritate your bladder lining. So you wake up and you got to pee and nothing comes out because it's pretty dark and concentrated. So again, it's really important to maintain a good amount of fluid intake. The other thing is if you're smoking, and hopefully none of your audience smokes, but smoking is a huge bladder irritant. It's also a risk for bladder cancer that a lot of people don't realize. I mean, we know about lung cancer, but bladder cancer, the number one cause, modifiable cause, is smoking.
Do we know if it's the nicotine specifically in cigarettes, or is it the innumerable other
It's
carcinogenic
probably
compounds?
the innumerable other carcinogenic. I don't know if it's nicotine specific. I don't think it's nicotine specifically, but generally speaking, the data is very strong correlation between, and we see it all the time in patients who smoke. So
I probably don't drink enough fluids during the day.
And
I tend to get
finish.
really thirsty at night,
Yeah,
and I just really it's very hedonic for me drinking like ice cold water before bed.
Yeah.
And so I find that that's probably the cause of it, because it's not like, I mean, I have a full bladder when I wake up. It's not like the urge to pee and nothing comes out.
Yeah, it's probably that you're just not hydrating during the day. So then obviously your body is compensating in the evening, and it happens to all of us. Like you'll notice, like if you've had a day where you're like, oh man, I forgot to drink, like you're gonna come home and pound like 3 or 4 glasses of water, and then you're gonna be up at night to pee.
Yeah, I want to talk about something that's pee related, but it's also related to sex, and that is the phenomena of squirting.
Yeah.
I don't know if that was the smoothest transition, but it's a
pretty
question that comes up,
transition.
and the question is in the context of sex, this phenomenon known as squirting, which I've never personally witnessed in the flesh anyway, and but a lot of people suspect that it's pee.
Yeah, so this is a controversial topic, not because we don't have a clear answer. So some people will say, yeah, we have a clear answer, it's pee, because they've done a couple studies. One was and these were like 10 like it was like really small, 10 to 30 people, like really small numbers. So one was they ultrasounded people's bladder before sex and after they squirted. These are people who squirted, and they saw that, yes, the bladder volume went down. So it was probably from the bladder. Another study actually put a blue dye into the bladder, and then they squirted, and then they saw blue dye in the squirt. So they're like, okay, it's pee. Now, they've looked at the actual composition of squirted fluid, and they've seen that it is like a very dilute urine. So it's not like urine exactly, and it has what we call PSA in it. So you may have heard of PSA in terms of the prostate. So women have a prostate. It's called the Skene's gland.
Whoa.
Yeah, and so it's right underneath the urethra, where people talk about the G spot, which is actually a zone. It's an erogenous zone where there's nerve endings. There's a Skene's gland there. It's about 2 or 3 centimeters in the top of the vagina. And so when you stimulate that can cause pleasure because there's nerve endings there that are pleasurable, similar to the male prostate. But that Skene's gland has the same type of fluid that prostates have, like a prostatic type fluid, and it emits PSA. And so they're actually seeing that, okay, yes, there's PSA in this fluid that is coming out during squirting. So people are like, okay, it's got to come from the bladder, because where else is it coming from? The Skene's gland is really, really small. Like they're not huge enough to emit that large volume of fluid. But generally speaking, the fluid is clear, colorless. Some people will say it's sweet tasting or whatever. So ultimately, it can't be just pee, and it can't be just from the Skene's glands. And so where is it? Why is it coming? Why is there so much of it? And where is it coming from? Right? It's not clear pee. It's not just from the Skene's glands. So there's a couple thoughts. One is that maybe during intercourse or during stimulation, your blood pressure goes up. It changes the hormonal, the way your kidneys, sort of hormones to your kidneys or signals to your kidneys that then make you filter faster so that the fluid is different. It's just a more dilute fluid. Or is it that maybe, I had an expert on my podcast who talked about imbibation. So like when you give estrogen to, I forget which animal model it was, but their uterus sort of like takes up all this fluid and becomes like engorged with fluid, and then you contract it, and it's from estrogen, so it's from hormones. And so maybe that's what's happening, is that the bladder wall is getting imbibed with fluid because of estrogen or hormones, and then it's when you squeeze the bladder during an orgasm, it comes out. So we don't really know. I would say there are people who do leak, or we call coital incontinence, like they'll actually have a leak event when they orgasm because their pelvic floor is weak. So it's, one is like there's definitely different sorts of fluid that are coming out, and then there's also people who ejaculate. There's female ejaculate, and that is distinctly from the Skene's gland, and that's a much smaller volume. It's like it's like very little. It's white, it's sticky. It's not like this clear odorless fluid that people are seeing when they squirt.
Wow. Is the Skene's gland, it's directly analogous to the male prostate?
Yep. Exactly.
And is it thought to be an erogenous organ?
Yeah, so if you think about, so for men, the prostate can be erogenous too. When stimulated, some men really enjoy prostate stimulation. And similarly, the Skene's gland can be an erogenous stimulator. But you can imagine all men don't find prostate stimulation pleasurable, and all women are not going to find.
Well, it just sucks that to get to it, you've got to go through the butt.
Right, right. So some women may not find it pleasurable. Some women will, or some women will find it pleasurable but won't orgasm from it, right? So it's not like this magic button, like, oh, you press the G spot and they're going to orgasm immediately. Like, that's not, I think we have this, people feel like, oh, there's this thing I don't know about and I'm not doing it right because she's not orgasming when I do it. Or she feels like, oh my God, do I not have this? Why am I not responding like I should? And I think that's a huge problem in general with sexual education, is like, we don't get good sexual education. Our sexual education is from like TV or pornography, where it's like, you know, penetration, climax, orgasm within minutes, and everyone's happy, right? Like, it's not reality.
I guarantee you that if the prostate were on the outside, every guy would be into prostate stimulation.
Yeah, probably. I would agree.
Is this one of the reasons why people, men, and I would assume certain women, are into anal sex?
Yeah, so interestingly, yes, probably that's the reason why men are into anal sex. Women don't have an organ structure right there, but their clitoral bodies are pretty close to, right, if they're close to the sides there, so you may have some pressure from anal penetration, and there's nerves there as well, so certainly there it is pleasurable. Some of them do it because it's convenient in terms of like avoiding pregnancy. Some people want to do it as a gift for their partner. Some people just want to try something new. But yeah, there's definitely a variety of reasons why women participate in anal sex. There was actually a study that looked at this, but it was an interesting study because they studied women who were drug users. And so it was like not a perfect study, but you know, it's never been replicated since then. So that's sort of what they came up with. There was a lot of them that were under the influence when they were having anal sex in that particular study. But I don't know if that's generalizable to the entire population.
Risk of STI, sexually transmitted infections, is higher, I believe, for anal penetration.
Yeah,
correct?
That's because the anus is very friable. And so very easily, if you're not careful, if you're not well lubricated, and especially if you're not using any sort of protection, which you always should, but sometimes people are like, well, I can't get pregnant or I can't impregnate my partner, so I don't need protection. But you still do, because there's still a risk of sexually transmitted infections.
Are there any non-infectious risks to penetrating an anus? I mean, are there, you know, structural risks, functional risks?
I mean, if you're very aggressive, you can cause lacerations or tears, then you can have bleeding. In rare circumstances, you could have some fecal incontinence or leakage of stool. But again, very uncommon if you have a normal functioning sphincter. And so, but you know, also if it's very uncomfortable, you can think, again, your pelvic floor is involved, right? So if you are penetrating an anus and it's very like uncomfortable or unwanted and your pelvic floor tenses up, your body can then have a response to that, and then you can develop some pelvic floor dysfunction. Again, these are not common things, but they can happen. Yeah,
I mean, I feel like some might consider it a taboo conversation to have, but I feel like probably correlating with the rise and proliferation and ease of access to pornography, I get the sense that a lot of people are doing it, you know, or at least interested in it. So I think it's, you know, it's worth talking about both the pros and the cons.
Well, interestingly, I had a guest on my podcast who told me, I had no idea that choking is on the rise. So that's like a very common, it's almost as common as kissing in the younger generation in terms of foreplay. And I had no idea. Or strangulation is actually the correct word, not choking. But yeah. And so like, I think there's a lot because of the rise of pornography and the accessibility that is now becoming so commonplace that hasn't been.
Rates of colorectal cancer are on the rise in younger people. Is there any connection between anal sex and risk for colorectal cancer?
I don't think so. I think it's more of, it's not anal cancer that are on the rise. It's colon cancer. So it's not going to be from anal penetration necessarily. We're not seeing, at least to my knowledge, I don't think anal cancers are on the rise. It's more colon cancers. And likely that's from our overall unhealthy population having less fiber in their diets and just overall more comorbidities that puts you at higher risk for cancer in general.
Would anal penetration increased risk for anal cancer? I mean, is there any mechanism there that...
I mean, I think the only I don't know enough about anal cancer to tell you specifically, but generally speaking, when you have chronic inflammation of any area, that can put you at higher risk for a cancer. So if it's resulting in an inflammatory cascade, which it shouldn't from anal sex, right? But if for some reason your body responds with inflammation, then perhaps, but I don't think so.
What are the best kinds of lubes to use, both for vaginal sex as well as anal sex?
Well, first off, when you're having any sort of lubricant, if you're using a water-based lube, which are the most common, or aloe-based, those are the most common ones you're going to see at the supermarket. You want to make sure that for anal and vaginal penetration, you're using different lubes because they have different pHs. So anal lube has a pH of around 6, and vaginal lube has a lower pH to match the bioidentical pH of those structures. So that's first and foremost. Water-based lubes are cheap. They're usually, you can find ones that have very few ingredients, so they're pretty less likely to have allergies, usually well tolerated, but they do dry out. So you need to reapply, especially during anal intercourse, because you need that to be very well lubricated. But in general, you want to reapply with those because they'll dry out. And then there's silicone-based lubes. Those are longer lasting. They're more slippery. They're more fun for some people because they last a longer time. You don't need as much. But there is this theory that you shouldn't use them with silicone-based sex toys. I think that's unlikely to be a real problem, but we generally say that because we don't want to be responsible for people's $200 sex toys having issues. And then oil-based lubricants are also great. They're like coconut oil-based or other oils, and those are also longer lasting. They can degrade condoms, so if you're using a condom with your partner, you don't want to use them. But I tell people, figure out what you like. Like, you come into my office, you're going to get samples, you're going to get to try them and see what you like, and sort of figure out what works for you, and then you go on and buy that. And you could even call, there's so many lubricant companies, they're happy to give you samples because they want you to like their product, and so you can even call them and be like, hey, I'd love to try it. Do you have a sample?
Coconut oil seems like a great option. Is there any concern about, because I know that lauric acid, which makes up a large fraction of coconut oil, has an antimicrobial effect. Any concern about coconut oil in the context of the vaginal microbiome?
Generally, if you are not having any issues, it's fine to use it. If you're having recurrent bacterial vaginosis, or recurrent yeast infections, I would steer clear of the coconut oil, just because it can actually put you at risk for yeast infections more so than bacterial vaginosis. But otherwise, no problem. Yeah. Very
interesting. When it comes to oral sex, what are the risks with oral sex? I mean, I know obviously there's always the risk of STDs. Is parasitic infection, something to be concerned about?
No, nothing like that. I would say generally oral sex is safe. You should use some barrier. So if you're performing oral sex on a female, dental dam, on a male, a condom, unless you've both been tested and you both agree that it's safe, because you can still contract STDs that way, or oral herpes or other things. But generally speaking, there's really not a lot of risk with oral sex for the most part. People aren't coming to the ER with issues from an oral encounter with their partner.
What about HPV? I mean, Michael Douglas famously, he has throat cancer, which he has attributed to cunnilingus, to going down on somebody with HPV, I believe. I mean, as you can easily Google, this is not, this is public information.
Yeah. So no, again, this is the same thing with STDs, right? You want to, HPV, so for the issue with men is you're not getting screened. Women are getting screened for HPV, right? When they get their pap smears, they're getting screened for it almost every year, every 3 years, depending on if they're monogamous or not. So you're getting the option to get screened for HPV, and you are getting screened cervically for that. So generally speaking, yes, if there is a risk, it's very uncommon, I would say, to develop a throat cancer from HPV. But again, it's inflammatory, right? So if you're getting a virus, if it's causing inflammation, and it can lead to a cancer.
How common is HPV?
HPV is very common, especially the genital wart variants of HPV is quite common. And that's why we screen for it, because we want to make sure that we catch the cervical cancer strains of HPV before it becomes cervical cancer.
How's it diagnosed?
So for women, we do what's called a pap smear. You send the cells off to the lab to look for HPV screens. And then if they're positive, you then do additional testing. So I'm not a gynecologist. I can't tell you the very specifics of the different algorithms or guidelines, but generally speaking, that's how it is. So when you go in for your annual pap smear, and then if you're monogamous now, they've changed the guidelines so you can go longer between screens, but it used to be every year. And then if you're still high risk or you're having multiple partners, I hate the term high risk because it's, but like if you're having multiple partners, you should get screened every year.
And for men, is it just visually, like whether or not somebody has genital warts?
Yeah, typically you see something and then you get screened for it, but you could always ask for screening if you felt like, no one's going to say no. You just ask like, hey, I'd like to get an STD panel. I get patients all the time who ask, and we just do it. No questions asked.
Wow. What about male health? Male urologic genital health?
Yeah.
What do the fellas need to know?
So similar to what we talked about earlier is keeping your body healthy, right? Blood flow. The number one thing that men deal with is erectile dysfunction, right? So 50% of men, 52% of men over 50 will have ED, and that increases every decade by like 10%. So 60% of 60-year-olds, 70% of 70-year-olds are going to have issues with erections. So you want to maintain your penile health. So what does that mean? That means that you're doing all those things to maintain blood flow. The other things that can cause ED are hormonal issues. So if your testosterone is low, now a lot of people think, oh, I'm not having good erections, automatically my testosterone is low. And that's not the case. It's only about 3 to 6% of guys where their ED is solely due to low testosterone. Now it can play a role, but it's certainly not the only cause. Psychogenic is a big part of it, right? So you can imagine if you have trouble with an erection one time, the next time you try to have one, you're stressed about it. You're thinking, am I going to have an erection? Is it going to last? Well, it's like cycling in your head. And of course, when you're stressed, then you don't get as strong of an erection or you don't get one. And then that gets worse and worse and worse. So that's a huge component, and certainly very common in younger men as well, because now, especially with the prevalence of pornography, we're seeing people feeling really insecure about their body, their genitalia, their appearance of their genitalia. And so that's another reason. Sometimes certain medications you're on can cause issues with erections, particularly antidepressants can be a big issue. Certain antihypertensive or high blood pressure medications can cause issues with erections. So there's a whole host of different causes of erectile dysfunction, and also neurologic, and that's usually less common. You may have like a true neurologic injury like multiple sclerosis, or those things can affect erections. So you want to, first and foremost, maintain your physical health to maintain blood flow. And then in terms of other things to sort of look out for is nighttime erections. So are you still having erections in the morning when you wake up, or in the middle of the night? Do you ever wake up with an erection? That's a good sign. That's actually a really sign that everything's working right. You've got good blood flow, you've got good hormones, things are working correctly. So that's sort of your barometer essentially of saying like, okay, my erections are good, things are working well. And so I'd say first and foremost, just maintaining that. And then, you can have issues with a whole variety of things in terms of, ejaculation, premature ejaculation, delayed ejaculation, less common. But those are probably sort of the thing that people worry about most, is like maintaining your penile health. And I would say that the best thing is, again, to maintain your your blood. Whatever's good for your heart is good for your brain, is good for your penis.
Absolutely.
Yeah.
Do you see erectile dysfunction in people who use hair loss drugs like finasteride and dutasteride? Yeah.
So unfortunately, there is post-finasteride syndrome. It affects a very small number of men. So like a lot of people use these drugs around the world. I mean, we give it to a lot of patients at the Veterans Hospital who have large prostates, and the large majority of them are fine. They don't have issues. But there is a small subset of men who have significant declines in libido. I've had patients tell me they took one and they noticed immediately that they felt like a switch went off or something. They noticed very quickly that their libido declined and their interest in sex declined. And so there is this small subset of people. So I always counsel everybody that this is a possibility. And if it happens, it can last for a while. Like you might take one pill and it might last for 6 months. And you're like, what happened, right?
Wow.
And so we don't know enough in terms of like why there's like are there factors that make certain people more predisposed to this? But certainly there is a risk, but it's again very, very small. So I don't want people to feel like I shouldn't take these medications, but you should know that there is a risk. And if that's something that you are not willing to risk at all, then maybe let the hair loss go.
Yeah, I mean, you gotta pick your battles.
Yeah, yeah, absolutely.
Is there a test, a reliable at-home test for nighttime tumescence? Because there's since I'm a child, I've always heard of this phenomena of morning wood,
Yeah.
you know, and I very, very seldom my whole life, I've never woken up with a morning
But it's not a
erection.
change for you, so that's a good thing.
It's not a change,
right?
yeah,
So
I
if
just
you
never-
were, and then you all of a sudden stopped, then it may just be the way your circadian rhythm is, that your erection happens before you wake up, right? Or whatever it is. But because it's certainly in the morning, the other thing is that your testosterone is at its highest. So very often that's why people wake up with morning erections, because they also have this high level of testosterone first thing in the morning. But in terms of nocturnal tumescence, we don't have great at-home tests. There are a couple companies that have devices that you can wear at night that will measure how many erections you have, and they'll give you a rigidity in terms of okay, this is your percent rigidity, or they'll give you an app to look at. I think it's a great idea for people who are really into numbers and they like to have that information, but realizing that it can really stress you. It's not a perfect test, right? So if you're the kind of person who's going to take that data and stress out like crazy about it, then maybe I would hold off, But it may be I'm taking a supplement and or taking a new medication. I want to see if it's making a difference, and you can compare the two. I think there's value in it, but it's still, not perfect, and not to a place where I think there's also some potential harm if you take that data too seriously, right? And you get too stressed about it, because stress is, again, the erection killer.
Yeah, it's a huge problem.
Yeah.
Are there any foods or supplements to help, boost the strength of one's erection?
Yeah. So generally we think about anything that's going to improve blood flow, and particularly nitric oxide, which is the ignition for erections. So certain foods have been studied. So watermelon is one we know is great because it's a really high dose or high amount of citrulline. And so there's been studies that have looked at not specifically erections, but the amount of arginine that comes from consuming watermelon. And so if you drink 6 glasses of watermelon juice, you see a significant increase in arginine. Now, if you love watermelon juice, by all means, but if you don't, I don't like to have people be very fixated on a certain food group. I'd rather you work on your overall nutrition so that you're maintaining your health, right? And if you find a food that you like that boosts nitric oxide, for example, like watermelon, by all means, take it. But I wouldn't people want quick fix. They want one thing to fix their problem, and then they'll put so many eggs in that basket, right? And they're not working out, and they're not doing the other things. And so, I caution in saying okay, these are the 5 foods you need, right? Because there's a lot of foods that are going to do good for your body. Anything with, vegetables, beets, watermelon, those things are all going to be good for you. But honestly, just maintaining, making sure you're getting a good amount of vegetables, fruits, enough protein, avoiding hyper palatable, unprocessed foods, right? Those are the keys to good health. And then the other stuff, add it in as you like it, right?
Yeah. I've always thought it'd be an interesting test to eat a big arugula salad.
Yeah.
About 30 minutes before sex, because arugula has the highest concentration of inorganic nitrates.
Yeah, I mean, I'm sure it's not going to be bad, right? First of all, you're not going to be super full, so that's a good thing. You're not going to be overly disgustingly full, so that's good, because that's going to, your blood flow is going to go towards digestion versus erection. So, you'll probably process that arugula salad. It won't be super filling. There's a lot of factors that go into it, right? So I'm certain that eating less and having a healthy diet is going to be good. But yeah, maybe if you like arugula, by all means, why not, right? Yeah.
But there's no such thing as an over-the-counter dick pill, I mean,
there's not a lot of data and you probably already know this. There's not a lot of data in the supplement space in terms of really high level quality, randomized control trials. And even the ones that are randomized are really they have a lot of bias, or they're paid for by the companies, or they didn't actually report everything correctly. So when you really dig into the weeds, there's not a lot of high quality data, and there probably won't ever be, because people will buy supplements without high quality data, right? And so I'd say probably the one that has the most evidence is L-arginine. And L-arginine is not very bioavailable. So I generally recommend L-citrulline if you're going to take a supplement, because it then becomes L-arginine, and you can take it less often. But again, I think there's no quick fixes, and you got to sort of attack it from all different angles. And, again, we'll never have the strong data that's going to be yes, this is the one we need, and this is what you should be taking every day. And it's not the same for everybody.
Yeah. Is occasional sildenafil use healthy? Is that, or because I mean, there are a few interesting things about Viagra. of course, obviously, there's the fact that it can enhance erections.
Yeah.
But there's been a handful of studies that have shown that it can, there's one study that found that it boosted muscle protein synthesis. So I know a lot of people, and I've done this occasionally. I've taken a pre-workout, which leads to incredible pumps in the gym. I'm not recommending that people go out and do this, but I've done it, and I thought it was great. And then I know that there's been this observational data showing that its use is associated with reduced risk for Alzheimer's disease, which is super exciting.
Yeah, so I think I say this a lot. I think tadalafil, a low dose of tadalafil every single day is great, because there is data that supports that it may actually improve cardiovascular health because it's dilating blood vessels, right, ultimately, and it's doing that for the heart too. And there's some data that shows it improves cardiovascular outcomes. It's, again, not prime time, like we're going to put this in the journals and be like, this is it. But there is some data. There's also some data that it, again, improves muscular blood flow to muscles. And so I think, yes, there's probably no harm in taking either a low dose of tadalafil every day, an occasional sildenafil, as long as you're not like taking 10 of them, right? Because people worry about, this erection that's going to last longer than 4 hours. Now, if you take it at a low dose and you're having normal erections, you're not going to have a problem. If you take it at a high dose, meaning you're taking the 2 or 3 or 4 of like 400 milligrams of sildenafil, yes, then you might get an erection that lasts longer than 4 hours. And I promise you'll never want to take that again, because that's a really scary experience.
Very dangerous.
Yeah, it's dangerous. It will stop. If after 4 hours, blood flow gets stuck, right? And there's no new oxygen going to the penis. So if you don't fix that, then you will start developing scar tissue in the penis. And so you have to go to the ER if you have an erection that lasts longer than 4 hours that's not associated with sexual arousal, right? And it has to be treated. And it sometimes can be treated with just taking medications, but oftentimes it requires us to actually drain the blood from the penis, which is, is not a pleasant experience, to say the least. And so I would never abuse medications like that, but I would say taking them as prescribed or a low dose is just increasing blood flow, and it's certainly not going to be harmful unless you're having side effects, right? Some people do get really bad headaches or flushing, or, with the Cialis or tadalafil, they get muscle aches, and then, I wouldn't take it. Like, why put yourself through side effects? There's other ways to boost blood flow, but if it's working for you and it feels fine and it's not causing harm, then by all means.
What about, there's a controversy around circumcision for men? Very controversial topic. I've no dog in the fight. I've no, I personally circumcised, raised Jewish. So for me, that's the norm. But there are a lot of people that believe that that there are certain considerations from a hygienic standpoint. I know, women sometimes have questions about it. In porn, you tend to see predominantly circumcised penises. Yeah. Any thoughts?
So in terms of circumcision, it is a very heated discussion from people. And so a lot of people feel like it's natural to be uncircumcised, and it is, right? And it's totally fine. And they get upset when you talk about circumcision because they say you're, taking away all these nerve endings that will then decrease pleasure. In terms of histologic studies where they've taken those tissues and looked at the actual types of cells that are on there, the ones that create a lot of are very sensitive to touch and are very erotic are these things called Meissner's corpuscles. And those are mostly at the coronal ridge, meaning right underneath the head of the penis. And that's not going to be taken away during a circumcision. The fibers on the coronal ridge are just like the tip of your finger. And so generally speaking, based on an abundance of data of like thousands of men looking at men who are circumcised versus not, even as adults, they did not see a cause of erectile dysfunction, change in sensation, or any really detriment to circumcision. Now, I don't want to diminish people who really feel like they did have a change, because there are people who feel like their life is ruined, they have no sensation, they have issues with erections after circumcision. It's a very small subset of people, but their experiences are real to them, and that's what they're feeling, right? And I'm not going to say that that's not true. I'm just saying based on the data that we have, that's what I can tell you. There is definitely, if you get a circumcision as an adult, you will have a change in sensation, at least acutely, right? Because you've had a gland that's been under foreskin for your whole life, and now it's not. So you're going to be hypersensitive for a while, up to 3 months potentially after a circumcision. In terms of hygiene, as long as you're pulling back the foreskin and cleaning the area and drying it and putting the foreskin back, you're going to be fine. not going to be an issue. The issue is when it doesn't get cleaned and smegma builds up. That's an inflammatory process, and then you can develop, the big scary risk is penile cancer. It's not common, right? It's very rare. I have absolutely seen men with penile cancer, and when you get a circumcision, that risk is essentially gone.
Wow.
Yeah. So, and then there is, a lower risk of sexually transmitted infections. And that's why it became so prevalent in Africa, for example, for HIV. And so there is benefit to circumcision, but it's a very personal choice. And I think that you need to make it based on, your own discussion with your spouse and, whoever your partner is that has the baby with you when you decide to make that decision. I don't have a strong feeling one way or the other.
Yeah, it is super interesting. I mean, it stands to reason that if you've got this super sensitive tissue that's been covered by skin for your entire life, it's going to be, I don't know, for lack of a better term, softer, more sensitive.
Yeah.
But I'll tell you, as somebody who's spent their entire life circumcised, I've never not enjoyed sex.
Yeah.
And I would think that by being more sensitive, I mean, it would probably it would probably disallow a degree of endurance, sexual endurance. I don't know. So they've looked at that in terms of premature ejaculation. There's not been a difference in terms of, yeah. Right. And I think it's, again, you have what you have, right? Like you wouldn't know any different because you had it as a newborn, and like people who are uncircumcised don't know any different. So it's really not a big change in terms of when you look at population-based data. At what age do they do it to Jewish boys? I should know this, but I don't know.
I think it's like 13 or something, right? I don't know.
Definitely not 13.
No,
that's the bar mitzvah.
Oh, okay.
The bris is when you get
it's a little bit older, but not that much older,
yeah.
Right? I don't know.
And I have no memory of it.
I don't know the age.
You're generally too young.
Yeah.
Very interesting. What else do you think people ought to know about sexual health that's under discussed today?
Oh man, there's so much. I think the important thing is to know your parts. And I think the other big, and especially if you have children, teach your children the parts, because they're not going to learn it in school. I think a lot of us think that our kids are going to have sex ed in school and that's the end of it, and we don't have to talk about it. It's this really awkward discussion, but they need to learn the truth from a reliable source. And at school, at best, they're going to learn about consent, putting on a condom, and avoiding STDs. That's probably what they're going to learn in that short period of time where they have and those are very important topics, but they're probably not going to learn like, oh, it's normal to have nocturnal erections. Oh, it's like, this is how it's normal for it to take some time to have foreplay. When you watch pornography, if you're exposed to it, which everybody will be, unfortunately, because it's so prevalent. I mean, you can't even scroll like Twitter with our ex without, being exposed to pornographic images. So, I think just like telling them like, this is not reality. It's an entertainment product. It's not what real sex is like. When you have questions, feel free to come talk to me about it. I think that's really, really important. And just talking about sex is so important with your partner, with your partners, whoever you are with, because if you don't talk about things, no one's going to know, right? So if you're not enjoying sex or you want something different, if you don't start talking about things, then it's never going to change, right? Because no one's ever going to feel comfortable bringing it up, and realizing that talking about sex is a learned skill. It's not going to be like you're going to have one conversation, it's one and done. You're going to actually have to have multiple conversations, and you're going to have to say like, and be open and realize that sometimes your partner may feel uncomfortable, they may shut down, and that's just because they don't know how to talk about sex. And don't take it personally, right? This is a very emotionally charged conversation, but it's one worth having, because sex is such an important part of intimacy. It's an important part of relationships for a lot of people. I mean, there's some people where it's not, but I'd say the large majority of people, sex is an important part of their lives. And if you don't talk about it and you just settle for dissatisfactory sex, like, that's what you're going to get. And, sex itself is a skill, right? And it's not going to be good the first time with somebody. That doesn't mean you give up on them. It means that you work at it. You learn what the person likes. You experiment. You have fun. You play with it, right? It's not this very serious thing. Like, you can actually play, enjoy, find out what you guys like, and keep moving.
Yeah. Why are you so passionate about this?
I think I realized when I started talking about sex, I realized how desperate people were for the information because they had none. They had none. And I realized like how much people are suffering because of that lack of information and because of the lack of knowledge of their own body. Like, just being like, I used to see patients come in and they'd be like, I'm doing this. Is this okay? And I would tell them, yeah, that's okay. And you would just see the stress leave their body. Like they needed someone to tell them that it was okay. And to be honest, even when you see a doctor, very often you're not going to get like a good discussion about sex, because most doctors are focused on all the other parts of your body and they're not really focused on your sex life. And it's still seen as like this extraneous, like extracurricular, right? It's not seen as a vital part of your life. But I've just seen so many people that really struggle with it and that benefit from optimizing. Their whole life gets better, right? Their whole life gets better because now they're having good sex and they're happy and they're comfortable. And it doesn't mean that they're cured of their issue, but their thoughts around sex are better, right? And sometimes we can cure their issue and sometimes we can't, but we work together to get them to a place where they're happy, they're satisfied, their partner's happy. And you would be surprised at how many people come to me and they're like so stressed because they can't get an erection and their partner doesn't care. Their partner is like, I just want to be intimate with you. It doesn't have to be penetrative. And they've never talked to their partner. They're just like, oh, I want to make sure she's happy or he's happy or whatever, right? And they haven't talked to their partner, and so they don't know. And so like it's just the very basics of being able to talk about it and talk about it openly can change people's lives.
Yeah, wow. I mean, you're doing such important work, and there's still so much shame around sex and people's bodies, you know. Have you seen that? Do you see a lot of
Absolutely. I mean,
shame?
Everyone will be like, so when women come to see me, they will be like, I'm so sorry, I didn't shave, or I didn't, right? Like, I'm so sorry, I hope it's okay. And like, yeah, of course it's okay, right? Like, this is your body. This is totally okay. And with men, sometimes they'll be like, oh, it's kind of cold in the room. Like, you know, like they'll make excuse. And I'm like, guys, I don't like, I'm not comparing you to anybody else. This is you, and we're going to take care of you. And like, it doesn't matter, right? That stuff doesn't matter to me, and it shouldn't matter to your partner. What matters is that you are both enjoying each other, you're having fun together, you're having pleasure, and that can be achieved no matter your anatomy, right? No matter how things look, you can find ways to pleasure each other that may involve penetration, may not. And again, it's really like there's so much you can do that is erotic and pleasurable, that is enjoyable if you just open your mind to it.
Where do you think all the shame and the stigma comes from? Do you think it's from a general lack of education, or do you think it's due to, you know, body image pressure from social media, which both men and women face? Everything. And think about when you were, if you probably don't remember this, but every kid at some point in time will maybe touch their genitals or maybe masturbate. They're doing it as a self-soothing technique. They don't know what they're doing, right? And the parent is like, don't do that. Right? The parent doesn't mean it in a bad way. They're just like, you don't do that in public, right? Or you don't do that in front of me. Or they are like, oh no, they also don't know that that's like a normal self-soothing technique. So immediately that instills shame, right? I should not touch myself. I should not talk about this. They didn't like it when I touched myself, so maybe I can't talk about this. Or if they did decide to try and talk to their parent about it, they might say, oh, no. They might have had an awkward response, right? Like, oh, like I had a friend tell me the other day, I was watching Friends and the couple was naked under the blanket, and my kid asked me, why are they naked? And she just sort of like brushed it off, right? And I was like, well, you should answer it, right? Like, should have been like, well, they are intimate, they're together, they love each other, and they wanted to be naked together. Like, you don't have to get into the details, right? But answer the question, right? And when my son very first time asked me about sex, I was like, okay, I talked to his dad, and I was like, look, I'm going to talk to him about sex. And he's like, oh, I don't know. And I was like, no, if he has questions, I will answer them. And he's like, okay, fine, you do it. And so we often talk about sex and whatever questions he has, and, you know, with both my sons. And so I think it's really important that they know they can talk to me, and that I've even told them, like, if you see something, let me know. If you have questions, let me know. You might see a movie or something that you have questions about. And, you know, I sort of leave it open. We talk about it often enough. I mean, not like every day, but, you know, we talk about it enough so they know that it's normal to talk about sex and that you can talk about it. And it begins, and I'm not saying I'm the world expert in talking about sex to kids, but I think that's where it starts. And then absolutely body shaming, especially with pornography, and you're seeing certain types of genitalia, certain lengths of genitalia, can be very, very strong. People, I mean, already body shaming is an issue with other parts of your body, right? But now add in something that's taboo that you can't talk to anybody about.
and then add in the lack of education, knowing that this is normal and it's fine and healthy. Like there's a lot of shame surrounding it in society, right? And so I think it's a lot of work that needs to be done to make it commonplace to discuss, but at least within your own home and within your relationships, it should be a safe place to talk about those things.
Absolutely. Yeah. I love that you've made your family a safe space for your children, and and encourage discourse about sex without shame or stigma. It's so important.
Yeah.
Do you think pornography is harmful?
I think that as an adult, using pornography for the most part is safe and healthy, as long as it's not become an issue where you're using it as a compulsion every day, avoiding other activities and maybe avoiding intimacy or avoiding relationships because you'd rather watch pornography. So as an adult, you have the decision-making capabilities to manage that. As a child, you don't know what you're seeing, right? And you don't know how to regulate that necessarily. And so that's where we don't know. We probably will never know how it affects a growing brain because no one's going to study that. That's not like a safe ethical question to study. But we know that the circuits are immature and they're seeing things that maybe they're not ready to handle. And, I think even if it doesn't cause them harm in terms of like they become, spending too much time watching it or whatever, when they first have sex with their partner and it's not like what they watched on pornography, that can be damaging, right? They can be like, something's wrong with me. I didn't respond like that. Or my partner didn't respond like they did on the pornography. Now am I broken? And like that becomes a very shame-inducing problem. And so I think, I don't know in terms of younger people, and I do worry about that. And I do really worry about how it affects our psyche in terms of sex.
Well, it's super interesting. I grew up with the internet, but I remember, my first porno was a magazine.
Yeah. I mean, mine was a videotape on a VCR. Like,
yeah, I had those too. Yeah.
Like it was hard to get, right? You had to like find time where nobody was around and, or you had to like know where to get it or your friend had to have it, whatever it was, right? And it was not easy. Now it's too easy, right? It's too accessible.
Well, not only that, it's also different. Like I remember the vast majority of porn that I would encounter as a kid was just vaginal porn. And now it's like the porns today, it's like straight to anal, and so
but no, I mean, I think the issue is that the reason it's there is because people are watching it, right? Like it wouldn't exist if people were not continuing to consume it and desire it, right? Like sometimes I like will see these things. I'm like, God, this is so wild and crazy, but like people like it. Like, people are watching it, right? And so I don't think it's, I don't think like, yes, there could be better ethical standards in some pornography in terms of like making sure there's good consent and there's safety and we're treating, women correctly and whatever. But in terms of like what is being displayed, it's based on the market that wants to watch it.
Yeah.
Right?
I just wonder what it's doing to kids who encounter that. You know, like just that. It's just so different.
Well, that's why strangulation is on
there you
right?
Go.
Like people are seeing this and they're like, oh, this is what people want, and so then they try it, and who knows if they're really having consent or talking about it, or it's scary. It's really scary.
It's out there. You have to, if you choose to consume it, I think you really do have to be able to forge a healthy relationship with it. The same with hyperpalatable ultra processed foods that are always at arm's reach today.
Yeah, I think just like learning how to, I mean, things have evolved, right? But so we didn't have smartphones. We didn't have access to whatever high dopamine producing thing, right? Like little games on your phone or checking your email 100 times a day or whatever it is that people do now that we never did before.
Yeah.
And so we just have to learn how to navigate our lives around the accessibility of that. And yes, hyperpalatable foods are everywhere, right? Like you can't go anywhere without seeing them, having access to them, and cheap and really easy to eat.
It's very comparable actually to, I remember when I was writing my second book and I found that there was, the data is in its infancy, but nonetheless I was reading, speculation that the neurobiological effects of consuming ultra-processed junk foods is not that dissimilar to when you're consuming hyperpalatable pornography.
Yeah.
It's super easy to access, there's no friction to accessing it. Mm-hmm. It's unlike, for the most part, anything that real sex
Yeah.
is like. So it's got this like hyper real aspect to it, similar to hyper palatable foods that are way more delicious than anything you'd find in nature.
Yeah. And I think people like to use pornography as a scapegoat. Like this is the reason for all my problems, right? Like it's because you watch pornography that you're having all these issues. But it's not like the pornography specifically. It's just that like you're using that just like people abuse food. If you're abusing pornography, it's really, that's the problem. It's not the actual thing. It's just something you can control, right? You can't get rid of food. Like I think, food's everywhere. You have to eat food, but you can stop watching pornography. And so people are like, oh, I can control that and I can deal with that. And it's something that's, I can control and that will maybe improve my life significantly. And so I think it becomes this real scapegoat for a lot of people.
Do you see a lot of women getting procedures like vaginoplasties or labiaplasties?
Yeah, certainly. There are people who feel like they want their labia to look a certain way. And I think, I just tell all my patients that, really it's about making sure you want it for the right reasons, because no surgery, whether it's cosmetic or not, does not have a risk, right? Any procedure you do, anytime you even put a needle in your body for any reason, there's a risk associated with it. So forget like cutting you open or cutting a piece of you off, right? And so I think as long as people understand the risks, there are a lot of people who are really significantly, they actually have discomfort because of long labia, or they're really significantly bothered by it. And in those cases, after you've ensured that you're in the right headspace, it's totally fine to go ahead and do it. But of course, everything has risk.
Are labia a sensitive tissue, or
they can be? Yeah, they are akin to sort of sort of like the scrotum. The labia majority, like the scrotum, the labia minora, do have some sensitive tissues there. And so you can have, after any surgery, but particularly after that, you can have like high sensitivity or, low sensitivity or things that can change with any sort of cut that you have. But most people tolerate it pretty well. Yeah.
Wow. I'm trying to think of what else I can ask you. It's just a wealth of knowledge. And so your practice, you're primarily a urologist? And do you see
I'm a urologist.
Both men and women?
I do. So I'm a urologist. I did a fellowship in what we call female pelvic medicine and reconstructive surgery, or urogynecology. So I see, and I also do sexual medicine. So I see men and women for any sort of sexual dysfunction, problem with orgasm, erection, ejaculation, arousal, lubrication. And then I see people for pelvic pain, for urinary issues like leakage, overactive bladder, any problem with that, any problem with enlarged prostate. So any urologic, generally BPH is a big one where we see bladder dysfunction. So a whole host of different things, prolapse and other reconstructive issues that are less common. But certainly, that's sort of my area of expertise. And I see men and women for all that.
Do you perform surgery?
I do.
So cool.
Yeah.
I had a urologic surgery a couple of years ago.
You did?
Yeah, like in 2014,
okay.
I think. I had intermittent testicular torsion.
No.
It was the worst. I woke up, I was like in my early 20s when this happened. I woke up, there were 2 occasions where I woke up from sleep and one of my testicles was torsed. And the first time it happened, it like resolved on its own. And the second time it happened, I drove myself somehow to the emergency room and I had to get it untorsed, and I had to consult with a urologist. They wanted to do the surgery right there.
Yeah.
An orchiopexy.
Right.
And I didn't do it right there. I went home and I, came to my wits about it, thought about it. But ultimately I had the procedure done and it's never happened. It hasn't happened since.
Good. Well, you luckily had the option. Sometimes when you get a torsion, which is a twisting of the testicle, that's a surgical emergency if it doesn't go away.
Yeah. And why is that? It's like very scary.
So it twists, it actually decreases the blood flow to the testicle. So if you don't treat it, you'll lose blood flow and your testicle will die, right? So you have to, and it's exquisitely painful, as you probably know.
The worst.
And so women have it too with ovaries, ovarian torsion.
What?
Yeah, it's less common, but certainly we see it in boys. It is something that is often one of the emergencies we deal with, that along with priapism we talked about, kidney stones that get blocked. Those are sort of the common emergencies for urologists.
Crazy. Yeah, I'm so glad I had it done. It hasn't happened since, and it was the most painful thing I've ever experienced. Are kidney stones common? How common are kidney stones?
Yeah, they're pretty common, especially we call the stone belt, like the Midwest, because of it's the diet is very high in salt, which puts you at higher risk for kidney stones. Certain oxalates put you at higher risk for kidney stones if you have a high oxalate diet, like spinach, rhubarb, those sorts of things, nuts. So very common. And yeah, people get them all the time, very commonly because of also dehydration. So not drinking enough fluid. And they are very, very painful, very similar to, like, you can always tell a kidney stone patient in the ER because they're like writhing on the gurney, like miserable in pain. It's really the worst. And it's luckily you can treat those things pretty minimally invasively now. We have like little lasers that you can break them up in small pieces and take the pieces out.
Wow.
But it's not fun.
Wow.
Yeah.
How is one to know whether or not they should be on a low oxalate diet?
Yes, if you haven't had kidney stones, you don't need to worry about it. But if you've had a kidney stone, we generally recommend a few things. Limit your salt intake, increase your fluid intake to about 2 to 3 liters a day, decrease your oxalate intake, increase citrate. So actually a good source of citrate is Crystal Light. And so you can just drink Crystal Light in your water.
Citrate is citric acid, right?
Yeah, so any, fruits and vegetables will have citrate, but Crystal Light tends to have a high amount of it. So
that's interesting. And why? Because it helps break up?
Citrate is an inhibitor of stone formation.
Ooh.
Yeah.
Very interesting. Wow.
Yeah.
I didn't know that.
Mm-hmm.
Yeah, because a lot of people on social media today will fearmonger certain foods like spinach and things like that.
Yeah. I mean, if you're not having kidney stones, eat spinach. It's fine.
Yeah.
Yeah.
Is there a way to reduce the oxalate content of spinach that's cooked? Do we know?
I don't know.
I
don't know about that. Yeah, that's a good question.
Wow. Well, Dr. Malik, you are a wealth of information. I'm so glad we had this conversation, and I feel like we could keep going, but I want to leave room for round 2. But you've answered a lot of my questions. I polled my audience on Instagram, and you answered a lot of their questions as well. So thank you so much for your time.
You're very welcome.
I've got one last question for you before we get to that. Where can people find you on social media and consume your content? I know you're very prolific, which I love.
Thank you. Yeah, so I have a podcast, the Rena Malik MD podcast. It's on YouTube as well, and I make also, in addition to the podcast, I make videos there on topics that people are interested in, a variety of topics. I have Instagram, TikTok, Facebook, all of them. Rena Malik MD. How
do you find the time between your clinical practice and all the content that you're putting out?
I'm a very efficient person, but no, I really it's a labor of love, and now I work a little less than I used to. I probably have a little more time to work on social media before, but still I work usually clinically at least 3 days a week, and then the rest of the time is to make content.
So cool. Such a fun and enlightening conversation. Well, the last question that gets asked everybody on the show, what does living a genius life mean to you?
Living a genius life is... Give me a second to think about this. Living a genius life is always striving to learn something new. So whether it's improving yourself with knowledge of ways to improve your body, improve your mind, improve the people around you, I think it's just really self-improvement in all aspects.
In all of its many forms.
Mm-hmm.
Couldn't agree more. Well, thanks again.
Thank you.
Hey, if you liked that video, you need to check out this one here, and I'll see you there.